Welcome to the questions and responses for the elbow. This is going to be fun. Let's get into this. Question 1 from Nancy Gillison, 4895. How does this apply to cubital tunnel issues? Okay, number 1, when you're looking at cubital tunnel, that's on the inside portion of the arm, and this is where the ulnar comes through. This is 100% qualify for the cubital tunnel. When you look at that, for one, you're going to have a problem with the cervical spine, which can compromise the blood supply or nerve supply to that area, but also that can create a muscle imbalance. Remember, that forearm, you've got that ulnar that generally moves towards the inside, compressing that cubital tunnel, compressing that ulnar nerve. Now, I can't tell you how many patients I've had that have had the cubital tunnel release or releasing the pressure off the ulnar nerve. But if that ulnar is shoved towards the inside, you've got to push it back no matter what happens. So the cubital tunnel surgery, it could be from trauma falling on it, but that is ridiculously rare. It's usually a misdiagnosed muscle imbalance. Remember, the flexors that attach to that medial epicondyle, that area right there should be 5, extensor should be 4. So you've got to look at the cervical spine, positioning of the ulnar and radius, and then restore that muscle balance utilizing that the number 32 rubber band. And you'll see that makes a world of difference. Even if you've had that cubital tunnel or cubital release, I still got to do it. Question 2 from Lenore121. Hi, Dr. B. My husband is 55 and flexors of his left forearm are hurting, especially when it's cold outside, and he tenses these muscles. The medical doctor prescribed only non-steroidal anti-inflammatory drugs, but I know it's not good for him. What might be the reason and solution? Thank you. Greetings from Poland. Poland, I'm going to be there first part of September. I'm going to see my son, and I'm speaking in Paris. I got a lot of family in Poland. Okay, flexors of the forearms are hurting when he tenses these muscles. Okay, with flexors, that's the medial epicondyle. So for sure, he has a muscle imbalance. To take a drug without listening to how the body is working is common in our society, but it is completely insane. So know that there is a muscle imbalance. He is also more than likely is going to have forward head carriage, so you've got to restore the curve in the neck. It'd be great to take an x-ray of the neck and the mid-thoracic area, but I know chiropractors in your country aren't allowed to do it. So hopefully you can find a sympathetic medical doctor that can prescribe the x-rays so we can see the lateral cervical extension and anasium, because there may be a lateral deviation to the thoracic area contributing to that compromised nerves in the neck. So if that heads forward, that's going to absolutely cause this. Because if it reacts, if you're getting an increase in symptoms, if it's hot or cold outside, it typically means the body's having a failure to adapt in that extremity. So there's going to be compromised blood supply and nerve supply to that area. And that has to come from forward head carriage. So correct the cervical spine, the forward head carriage, do that, and number 32 rubber band exercise to correct the muscle imbalance, and have the chiropractor set that ulnar, and he will be good to go. And fire the medical doctor. Question 3. From user KB5BH1KG4Y. I'm a 66-year-old male. I am left-handed, having trouble with a trembling left hand. Hugely important clue. If I squeeze my left arm at the forearm or side of the elbow, it steadies the trembling and allows me to shave. The right hand is not experiencing trembling. Thank you. Number one thing, this is neurologic. Your body is going to increase motion if it requires more sensory input into the brain. So this is definitely neurologic. So you've got to look at not just the cervical spine, which is going to be one of the contributing factors, obviously, but you have to look at the gut health, and you've got to look at the blood. That blood, when you're in a stress state, they should have an electronegative charge, the red blood cells, and that means they hold oxygen. When you're in a stress state, they start to stack, and that means that it's not getting oxygen. Also, your dad may be exposed to certain neurotoxins that I can't talk about here. Okay, but look at pesticides, look at certain medical procedures or medical interventions that may have been forced in the past. A lot of these things can cause neurologic damage, but this is more than likely an upper motor neuron lesion where one part of the brain is not functioning correctly. And so the body is starting to get more sensory input into that brain, because that's what the trembling is. That's also what any kind of like shaking is. The body is needing that to generate information into the brain. So clear the cervical spine, fix the gut, look for any toxic environmental exposures, but know that this is the biggest red flashing light you can possibly have. One of the reasons that when you tighten it up, the shaking stops, because think of this, why would the brain start to shake something? Because it's not getting input from that area, or the brain needs stimulus. When you tighten that up, you're getting more stimulus. So then the need for the shaking is not there. So understand that this is a brain issue. And the brain, through neuroplasticity, it can regenerate. But that shaking means that the brain is suffering from either toxicity or deficiency. And movement is a nutrient to the brain. Movement, the brain is like a battery, and it gets its charge from the position and motion of not just the vertebrae, but the entire body. That's why you got sensors on every joint. So get him to a chiropractor that's skilled in neurology. And I'll help in any way I can. Question 4 from Mr. Walbaum. Dr. B, question. Can I restore the curve of my neck without getting chiropractic adjustments? I have really bad carpal tunnel syndrome. It's hard for me to afford the treatment. I'm the sole provider for a family of 5. Things are very expensive right now with Biden in office, as you know. Just wondering if I could relieve some of the pain all over while I sleep. That's when it's at its worst. I've tried the electrical tape across the hand, and it doesn't seem to help at all. Big fan, been watching for years. Much love from Washington State. God bless you, Mr. Walbaum. Okay, let's get you healthy. Buddy, there's a lot that you can do. Okay, number 1, I want you to look, because if that tape, that electrical tape, isn't helping, then there's some major stuff going on with the cervical spine. Since you can't afford care, look at all of our videos. And I mean, getting something to stabilize the pelvis. And that could be a scarf tied super tight when you're standing or walking. When you're sitting, sit with a liter plastic bottle of water, and it goes bottom of the elbow, bottom of the roll. So look at our lumbar health videos, because by restoring the lumbar curve and stabilizing the pelvis, you're going to reposition that thoracic area, and that'll take some of the pressure off. So restore that lumbar curve. Look at everything we have to restore that cervical spine. Now, since we don't have x-rays, but I do the same thing if we were in the jungle. If you're doing something, some kind of exercise, like you're doing the cervical restoration exercises, and you're sore more than an hour afterwards, you're pushing it too hard. So that will be an alarm. And this is what I tell all my patients. If you're doing a certain exercise and you're sore less than an hour, go do it some more. Okay, if you're sore more than an hour, you might be pushing your body too much. And you want to, if you're going to do the cervical extension exercises, do it up to the point of discomfort. And if you're doing 4 or 5 of them, and after that say 5th one, you can't go as far, or it hurts more, stop it immediately. Okay, so listen to your body. The greatest doctor in the world is inside of you. Okay, and that's why your body is self-healing, self-regulating, and you're built in the image and likeness of God. So your body is designed to repair, but also look at all the range of motions that you can do. Make sure your chin's up, you're sitting up straight, turn your head as far to one side as you can, as far to the other side as you can. Go back to neutral. Put your ear down to the shoulder as far as you can, if that's as far as you can go. If you can go all the way, beautiful, go all the way. If you can turn all the way to 80 degrees, then all the way to 80 degrees, fantastic. Okay, but do that full range of motion every day. And the discs get their nutrients through movement. So move every joint every day. Then Look at our sleep restriction videos. So change your circadian rhythm so you're sleeping through the night. You can. So look at growing your own food. And I mean, if you're in an apartment, okay, you can grow your own food and you can make things out of Home Depot plastic buckets to grow potatoes. I mean, there's a lot of things that you can do to get healthy nutrients in the system because you need to get the nutrients to rebuild the tissue. You need to change the sleep patterns and every movement up to the point of discomfort until you're able to move it completely. Every movement that you can move just a little bit, eventually you'll be going all the way. So move every joint every day. Walking, best exercise in the world. Walking with small arm weights, even better. So there is ways to start to restore the curve in the neck. I'd like to know what the baseline looks. But the best obviously is to get an adjustment so you're creating inflammation, you're changing proprioception. But all of that stuff you can do for nothing but the cost of time. Okay, God bless you, brother. God bless you. You're doing the most important job ever. You're taking care of the family. That's the hugest thing. Now, question 5 from Charlie Conda 2860. Hi, left ulnar-sided wrist pain, that's right there, for 18 months. Started as ulnar nerve tingling at night and progressed to pain whenever flexed or extended force. When picking up a plate, non-tender, my chiro gave up. Yeah, fire that guy. And my GP suggested I see a psychiatrist as the MRI was clear. Oh, gosh, the frustration you've got to see. Now, the same pain in both wrists, so convinced coming from the neck. Question, how do you know when an injury or pain is localized or referred? And or how is cortisone injections meant to work? And or pain gets worse throughout the day if wearing a watch, even loose, is this double crush? Okay, so let's go all over this. For one, my heart goes out to you because when there's a combination of arrogance and ignorance. If the doctor says, well, since I can't find it, it must not be there. No, then this doctor's got to go back to normal school. Okay, greatest doctor in the world. One of my mentors said, you got to do 2 things to help people. 1, you got to ask them. 2, you got to listen. And it's just like if all doctors understood that, parents who have told their pediatrician that the child was acting different after certain medical procedures, we'd have healthier kids. If doctors would actually listen to the patient, okay, and realize that patient is giving you information to get them help, that would be huge. And I've got a big problem with GPs like that. So how do you know if the injury or pain is localized or referred? Number 1, if it's just in the area, okay, that's generally going to be localized. I say generally because you could have a compromised nerve in the neck and it's going to be sensitization up there. Referred is generally pain going away from a joint. So like if you have pain right in the middle of your arm, like a lot of people will say, my arm hurts right here. Okay, and they're pointing right at the C5 dermatomal pattern. And I'll say, well, really? Okay, so when the patient's saying it's right here, I'll say, where's that pain again? Where's it coming from? Well, it's coming right here. And they'll even trace it with their hand. So the doctor's really got to be more clear. But just generally, if it's going to be localized and your pain that you're describing is not, because you're opening and closing that, tingling, okay, electrical burning, sharp shooting, tingling, those are all neurogenic pain, so it means some nerve is compromised. How is cortisone injections meant to work? Well, it shrinks the swelling. It's an anti-inflammatory. It also destroys the joint cartilage. I mean, it's the dumbest thing in the world to shoot a joint with cortisone. For one, you're not looking at the blood supply or nerve supply, so no one's looking at the forward head carriage. If you're just going to shoot an elbow or a wrist or whatever with cortisone, you're not looking at the muscle imbalance or malposition of the ulnar or radius. You're not looking at anything. I mean, it shouldn't be allowed. Okay. And in fact, luckily, just in the last few years, they've said, okay, you can shoot a joint no more than 3 times because on that'll destroy joint cartilage. So if they're limited to 3 shots for a joint, is one really healthy? How is it meant to work? It's meant on a completely abnormal paradigm that inflammation is a drag and attack in the body, and it's inflammation that hurts. And so they're going to stop inflammation. Inflammation, wake up call, it's for healing. So it means there's some tissue damage. It's just, I mean, that it should be like the year 1 that you learn that stuff. Pain gets worse throughout the day if wearing a watch, even loose. Is this double crush injury? No, wearing the watch, okay, and having that sensitization there is not the sign of a double crush injury, but it could be the result of a double crush injury, meaning you have compromised nerve supply, because you're describing ulnar nerve, all the way. And that ulnar nerve can be coming from the base of the neck or from the medial aspect of the ulnar. Okay, so could be direct trauma there. There could be a lot of things. But when you pinch a nerve, it gets more sensitive. So that makes a heck of a lot of sense. What I mean by that, but this is how you can explain it to everyone. Has your arm ever fallen asleep? Yeah, of course. When my arm's around my wife, boy, I don't want to move it because she's cute and I want to keep it there. But even if the arm falls asleep, what does it feel like when it comes back? It's all pins and needly. That's because when you compromise a nerve, it gets more sensitive. So you are absolutely demonstrating ulnar nerve impingement. Could be the cervical, could be the elbow, could be the wrist, somewhere. Okay, but that nerve is compromised. And that's going to be the end result of more than likely a double crush injury, beginning in the neck, could be. But then you got to find out why the neck's a problem. Is there a lateral deviation of the thoracic, or what's going on? Find the problem, fix it, and listen to your body. Your body is giving symptoms for a reason. And you can show this to your GP and tell him, I will help him to listen to his patients. Oh, now if your question wasn't answered here, go to the Dr. B VIP,